meeting is now being recorded.
Welcome, everyone. Thank you for joining us for the Lunch and Learn webinar. My name is Donna Karras. I'm your host. Today's webinar is No Judgment Zone, Learn About Freedom from Smoking and Other Resources with Jenny Cradaville. Jenny is a trained Freedom from Smoking facilitator and manager of the pulmonary services at Lakeview Hospital. And let me turn this over to Jenny.
Hello, everyone. So just to get started, just to kind of recap, we're going to just talk briefly about the Freedom from Smoking program, which is part of the American Lung Association, and then also cover just some basic other programs that would be available, and then also nicotine replacement therapy options for those that are thinking of quitting smoking. To begin, most smokers know today that smoking is bad for their health. They know that smoking is harmful to others, and they also know they should quit, but they also know it's going to be hard. The reason it's going to be hard is because of the nicotine addiction, years of habit, and fear of failure. I'm here to tell you, don't let those factors sway your decision to quit. Quitting can be tough, but you can do it. It often may take several tries, but the key is just to not give up. Why is it important to quit? Obviously, we know for health reasons. Smoking causes 90% of all COPD, or chronic obstructive pulmonary diseases, which include chronic bronchitis and emphysema. Lung cancer is also the #1 cancer killer for both men and women. Another example would be to save money. Who doesn't want to save a few dollars? Based on a $5 per pack, which I know is outdated, in 1 month you would be able to save $150, 1 year $1,800. In 10 years you would be able to save $18,200, and after 20 years of being smoke-free, that could save you $36,400. Another important reason to quit is for the health and well-being of your family and friends. Second and third-hand smoke are very dangerous. It's harmful to everyone who inhales it. A lot of people don't know much about third-hand smoke, but this is a smoke that clings to a person's hair, clothes, furniture, and carpeting. Think of the little kiddos you have at home. They're crawling around, if you are smoking in your home, on the carpet. They're sitting on your furniture, cuddled up with the blankets that all have third-degree smoke, or third-hand smoke, I'm sorry. Also, if you have children at home, they are more prone to get colds and have more prevalence of ear infections. While there is no risk-free level of tobacco smoke, even brief exposure is unhealthy. Here are a few of the health benefits you will notice after you quit. Within the first 3 months, you should notice that your breathing will become easier. You'll have increased lung function, and physical exercise will be a little bit easier. Food will even taste better as a non-smoker. Smoking decreases the sense of taste and smell. And if you think about it, have you ever noticed that current smokers add more salt, pepper, and other seasonings to their food? In the next 9 months, smoking and your shortness of breath will decrease. You should have increased energy levels. And because of the little hair-like projections in the lungs called cilia, which aid in secretion removal, are repaired after you quit, you will have fewer lung infections due to the cilia's ability to clear your lungs of harmful infectious material. After 2 years of being smoke-free, your risk of coronary heart disease is half of a smoker. Your heart attack risk drops to nearly normal. And after 5 years, your lung cancer death rate reduces by half, as well as your risk of mouth, throat, and esophageal cancer will be half that of a smoker. This page has a following quiz. This is through the American Lung Association Freedom from Smoking. It's a short little tool that you can see, are you ready to quit smoking? It's a self-assessment. If you answer yes to 4 or more of these questions, you are ready to quit smoking. I would encourage you to take this quiz at your leisure. No matter how many times people suggest or encourage you to quit smoking, you have to do it for you. You need to be ready in order to be successful. So how do you know if you're ready to quit? Taking this quiz will help you decide. But remember, you have to make this change for you, not anyone else. Do it only for you. As a Freedom from Smoking facilitator, we'll just touch briefly on what this program entails. For the history of it, it was developed in 1975 for individuals who have acknowledged that they are ready to quit smoking. Because, as we discussed earlier, most people know that smoking is dangerous for their health, This program focuses on exclusively how to quit, not the reasons why you need to quit. We do touch base on why to quit because we need to figure out, number one, why you're smoking in the first place in order to be successful in quitting successfully. Freedom from smoking is no judgments, there's no browbeating, we don't point fingers, and we don't blame. It is a supportive environment in a group setting. Freedom from smoking uses techniques based on pharmacological and psychological principles designed to help you gain control over your behavior. There are multiple techniques offered during freedom from smoking because one technique might not work for the next person. This also includes the latest research about nicotine replacement therapy and other smoking cessation medications. The comprehensive variety is important as one method might not work for Joe, but Becky responds to another. We use self-realization techniques tailored to help you change your behaviors. It's all about lifestyle changes and how to be successful in your choice. Here are some general statistics from the American Lung Association. Freedom from smoking, just simply, it works. When used in combination with other cessation medications, up to 60% of participants report having quit by the end of the program. It generates a higher quit rate than people who are trying to quit on their own. For example, 25% of participants report not smoking 1 year after the program, while only 5% of people who quit cold turkey remained non-smokers after 1 year. Freedom from smoking is customizable with a wide range of options. Like I had mentioned before, it's tailored to each individual member. One method might work better for somebody else. A choice of leading employers, hospitals, and health plans for over 30 years. And it's ranked most effective smoking cessation program in a study of 100 managed care organizations conducted by the University Graduate School of Business. So what does freedom from smoking look like? This freedom from smoking clinic consists of 8 sessions. Each class lasts about 1.5 to 2 hours. They are 1 day a week, except for quit week. On quit week, we quit on the 4th session and meet 48 hours afterwards. Sessions would be led by myself. I'm a trained facilitator from the American Lung Association. We always meet in a small group. We want to have a minimum of 5 people entering the program. Maximum can be 10 to 12. Our largest group we've had at Lakeview was 13, and our smallest was 5. It's important to have a group supportive environment, but also small enough where you can still get the personal attention and create your own quit plan. Here are a list of the topics that are covered from the Freedom from Smoking Clinic. First, you take a personal assessment to determine your readiness. It's very important to know if you're ready to quit smoking before you can take the next steps forward. Nicotine replacement therapy is presented in each session and highlighted in the early sessions. With freedom from smoking and nicotine replacement, you have a better chance of quitting. The program gives you the tools to change your lifestyle and adapt to behavior changes, while the replacement therapy helps with the withdrawal or recovery symptoms. You will learn behavior changes that you can apply to your daily life to avoid smoking. We will guide you individually through this process step by step. You will develop a plan of action leading up to quit day so you know what to expect on quit day. And then quit day through the end of the program, you will get the continued support of your group. The scientific behavior is based on a methodology with pre-contemplation, contemplation, preparation, action, and maintenance. These are behavior change models. We address the difficulties of quitting with a sensitive, supportive style, and the ultimate goal is to encourage individuals to overcome their addiction and enjoy the benefits of better health. There are other freedom from smoking tools that are accessible if the in-person clinic is not the best option for your lifestyle. The first one is freedom from smoking online. This next slide is pretty small to read, but I can just kind of briefly touch on it. What this includes is it's 12 months of unlimited freedom from smoking online program, available 24/7. You have live telephone and chat support from specialists at the Lung Helpline. And there are 9 interactive sessions to help you prepare for quit day. And you also get a certificate of completion or quitting, which may help you lower your health insurance costs. These memberships, this is a common program if there was a business or a company that wanted to have an entire department go through freedom from smoking. and its membership cost is based on per person. So 1 to 9 people would be $99.95. But again, that's for 12 months of unlimited access and support. There is also the Freedom from Smoking Lung Helpline. This is free of charge. This is where you can call in and talk to certified counselors who will specialize in helping you quit. They also offer nicotine replacement therapy options. They will talk you through if you're ready to quit and help you make a quit plan. And that is available 24/7, and it is free. And there is a Freedom from Smoking self-help guide. This is a workbook with key activities in an easy-to-follow format, and it has cessation tools that can be used in conjunction with, say that you wanted to use the helpline and also use the book as well. I apologize, I have called the American Lung Association. I don't know the actual cost of obtaining this, this self-help guide, but it is available. So regardless of your quit method of choice, whether it's going to be a Freedom from Smoking clinic or doing it online, or just tackling the addiction yourself, regardless of your choice, pairing it with the nicotine replacement therapy is key. It's not an easy way out, as some people will say. It actually enhances your chance of successfully quitting. So why is it important? First, it helps to understand the nicotine addiction and dependence. When the brain receives nicotine, in less than 10 seconds, by the way, the nicotine binds with brain receptors which are normally dormant. Once activated, these receptors release chemicals that deliver that high or that kick that everyone is looking for. This is what then will drive addiction. Dependence can occur very quickly in some people, even after smoking their very first cigarette. As the nicotine level in your brain decreases, withdrawal symptoms cause the brain to want more, and people then feel like they have to smoke again to get rid of the symptoms. Fun fact for everyone, regardless of how bad your craving is, it is scientifically proven that it will go away in 3 minutes, no matter if you smoke or not. So 3 minutes might seem like a very long time, but if you can make it through that 3 minutes, those symptoms will subside. These receptors are also why people who have quit smoking for years can easily become addicted again after one cigarette. Just as before you started smoking, the nicotine receptors go dormant after you quit. However, once reactivated, the urges will be in full force. I'll first talk about some of the over-the-counter nicotine replacement therapy options. The most familiar is probably the nicotine gum. Nicorette is the brand name. There are generics available. You can get a prescription for the over-the-counter nicotine replacement options, and your insurance will likely cover the cost of that medication or that replacement. Nicotine gum is chewed to release nicotine that is then absorbed through the tissue inside your mouth. The user chews gum until it produces a tingly feeling. Then the gum is parked between the cheek and the gum tissue. The gum dosage for you will depend on how heavy of a smoker you are. And you can see that they're listed here based on if you're a light or a heavy smoker. The goal will be to take smaller and smaller doses over a 2 to 3 month period of time. The second over-the-counter option is the nicotine lozenge, or commit is a formal name. There is a generic available. They look like hard candy and are placed in your mouth to dissolve quickly. They are regular and mini-sized lozenges. The minis look like tiny Altoids. The larger format looks more like a Werther's Original. They come in 2 milligram and 4 milligram dosage. One key to knowing how much you're going to need is if you smoke after 30 minutes after walking, you can use the lower 2 milligram dose. If you need to smoke less than 30 minutes after you're out walking, use the 4 milligram. Again, just as with the gum, you would take smaller and smaller doses over a 3 month period. The patch. Everyone is familiar with the patch. They do have generics available, and there are different strengths available with the patch. These patches are placed on the skin and supply a small and steady amount of nicotine into the body. The patches contain various concentrations of nicotine, and the user reduces over time as well. Now on to a couple of prescription options for nicotine replacement therapy. The nicotine nasal spray, or Nicotrol. This is a pump bottle containing nicotine that is inserted into your nostril and sprayed. And this can be used for fast craving control, especially for heavy smokers. There is a warning not to exceed 5 doses per hour or 40 doses per day, and you would use this for 3 to 6 months. One thing to think about is if you have any allergies, asthma, or sinus conditions, to not use the spray. The nicotine inhaler, or the Nicotrol inhaler. This entails a cartridge attached to a mouthpiece. This works pretty well for anybody that has the oral fixation for the cigarettes, that they're really fixated on that oral and can't get away from not having something in their mouth. This one is just a mouthpiece with a cartridge. The nicotine is absorbed through the lining of the mouth and throat. So just like a cigarette, you would inhale, but the vapor stays in your mouth for a few seconds and you blow it out. So it's not actually going into your lungs. You use this for up to 6 months, taking smaller and smaller doses over a 3-month period. Zyban, which is Wellbutrin. This does not contain nicotine. All of the other products we mentioned before have a nicotine component in them. This one does not. This simply reduces the withdrawal symptoms and the urges. It can be combined with other replacement products such as gum or lozenges to increase your success of quitting. With Zyban, you would want to start this medication 2 weeks prior to quitting, and then you would want to continue to take it for up to 6 months. And I think everyone has heard of Chantix before. Chantix does not contain nicotine either. This one medication works by blocking the nicotine receptors in the brain, which then will block your urge to smoke. So the receptors that become active when we become addicted to nicotine, this is actually taking the place of that nicotine on the receptor, so it's blocking your urge altogether. The starter pack includes a dose titration, and then you would want to start this 1 week before you quit and take it for up to 3 months. You can use, there are some patients that will say that with Chantix they've had some dreams or some ill thoughts, so this is something that you would want to talk to your physician or healthcare provider about any of your nicotine replacement therapy options before starting. Just some simple tips. The average smoker tries to quit 5 to 9 times before they are permanently successful, and each attempt will get you closer. So even if it's your 4th time and you're getting frustrated, you've at least successfully attempted to quit 5 times, and you're getting closer and closer to permanent success. Like I mentioned before, combining medications with a program doubles your chance of success. And also, we didn't touch on any of the other tobacco addictions, but freedom from smoking can be used to curb any addiction, whether it would be cigars or chew, any type of tobacco addiction. To summarize freedom from smoking, the participants will experience immediate health benefits. We discussed the physical, mental, and social aspects of addiction. You are 6 times more likely to be smoke-free 1 year later than those who try to quit on their own. And when used in combination with smoking cessation medication, up to 60% of participants report having quit smoking by the end of the program. This next slide shows that we have a Freedom from Smoking class scheduled to start on Monday, February 13th. Registration is required, and that is required by Wednesday, February 8th. You can go online or you can call. Class dates are on Mondays, except for our quit week, which we will meet also on the Wednesday of that week. We meet twice on quit week because 48 hours after you quit, that's when you're going to have the most symptoms, and that's when you're going to need the most support. And these classes are located at Lakeview Hospital in Stillwater. All right, thank you for your time.
Thank you, Jenny. Appreciate you giving this information. And once again, feel free to give us a call or register online for the Freedom from Smoking class. Or if you have any questions, give us a call. Thank you.